This presentation is part of a series of presentations on infection control in care homes. The key outcomes are to understand how infections are spread and to understand how to prevent the spread of infection by understanding the core elements of standard infection control precautions. Also to understand the key principles of reducing the spread of viral gastroenteritis in care homes. The first 4 presentations focus on the core elements of standard infection control precautions. The first focuses on cleanliness and decontamination. The second focuses on bloodborne viruses and the management of inoculation injuries. The third focuses on the use of personal protective equipment. The fourth focuses on hand hygiene. Standard infection control precautions should be applied in all healthcare settings to reduce the risk of infection to patients, residents and staff. The fifth focuses on the key principles for reducing the spread of viral gastroenteritis in care home settings. This is the 4th presentation in the series and focuses on hand hygiene. It is well documented that hand decontamination is the single most effective step in the prevention of spread of infection. The spread of bacteria and viruses from one patient or the patient's environment to another can lead to infection. Spread of germs on the hands of staff is a major factor in the spread of infection. It is also well documented that effective hand hygiene can significantly reduce the carriage of harmful germs and therefore reduce the risk of cross-infection. How does hand hygiene work? Hand decontamination works by removing dirt and reducing the levels of germs on your hands. When you wash your hands, you should start by wetting your hands, preferably with warm water. Then apply liquid soap. You should not use bar soap. Ensure that all surfaces of your hands and wrists are washed. You can do this by rubbing your hands palm to palm, rubbing your hands palm to palm with your fingers interlaced. With your fingers interlaced, rubbing the back of one hand with the palm of the other hand and repeating this with the other hand. Rubbing with the backs of the fingers into the opposing palm with fingers interlocked. Rubbing each thumb clasped in the opposite hand with a rotational movement and repeating with the other hand. Rubbing the tips of the fingers into the opposing palm in a circular motion and repeating with the other hand. Rub each wrist with the opposite hand and rinse your hands thoroughly. Where possible, you should use your elbows to turn off the taps. Dry your hands thoroughly with a single-use towel. If you don't have elbow-operated taps, use the paper towels to turn off the taps. Dispose of your towels in a foot-operated bin. Be careful not to get your hands dirty once you wash them by lifting the bin lid with your hands. Hand washing should take about 30 seconds. Using alcohol rubs is a quick and effective alternative to hand washing. An alcohol rub can be used in many situations. However, it has its limitations. You should not use an alcohol rub when your hands are visibly soiled or have been exposed to blood, body fluid or organic matter. You should not use an alcohol rub when you are caring for people who have diarrhea and vomiting. You should not use an alcohol rub when there is an outbreak of diarrhea such as Clostridium difficile. In these situations, you should wash your hands with soap and water. Your hands should also be washed after several consecutive applications of alcohol gel. The World Health Organization 5 moments for hand hygiene indicates when you should clean your hands. Clean your hands before touching a person when approaching him or her to protect the person against harmful germs carried on your hands. Clean your hands immediately before a clean and aseptic procedure to protect the person against harmful germs, including the person's own germs, from entering his or her body. Clean your hands immediately after exposure to body fluids and after glove removal to protect yourself and the healthcare environment from harmful germs. Clean your hands after touching a person and her or his immediate surroundings when leaving the person's side. Clean your hands after touching any object or furniture in the person's immediate surroundings, even if the person has not been touched. This is to protect yourself and the healthcare environment from harmful patient germs. When you are in the work environment, you should remove all wrist and hand jewellery. You should be bare below the elbow. You should cover cuts and abrasions with a waterproof dressing. You should decontaminate your hands before and after contact with a resident or an activity that may result in your hands being contaminated. You should decontaminate your hands between residents and between different care activities for the same resident. You should always wash your hands after removing gloves. You should keep your fingernails short, clean and free from nail polish with no false nails or nail extensions. Hand decontamination products can be potentially damaging to the skin, so you should remember to wet your hands before applying soap and rinse soap off thoroughly to reduce the risk of skin damage. You should also moisturise your hands regularly. You should report any problems with the use of hand decontamination products to your manager. And you may also need to get advice from your organisation's occupational health department. Further information is available in the Public Health Wales publication Communicable Disease Control, a guide for care staff. Remember that infection control is everyone's business and everyone has a role to play in protecting your residents.